So what happens when an AI plays doctor? I mean, really plays doctor. Today, we're digging into a pretty shocking scandal where a powerful algorithm was given the authority to make life or death decisions for thousands of vulnerable patients. And, well, the results were devastating.
Let's just start with this one number, 90%. What is that? Well, according to a major class action lawsuit, that's the error rate of an AI tool used by UnitedHealth. It's the percentage of times its denials were completely overturned when a patient was actually able to appeal. A 90% failure rate in a system making calls about your health. Just let that sink in.
And you have to remember, behind a number like that are thousands of real people. People like the son of Deirdre O'Reilly. Now, she's an ICU doctor, and even she found herself battling an insurer's denial for her own child's emergency care. Her story just hammers home the terrifying stakes when an automated system gets it this wrong.
So what exactly was this tool at the heart of the whole controversy? How did it work? What was it even supposed to be doing in the first place? Let's meet the algorithm.
Okay, so this is NH-Predict. It's a predictive algorithm that was used by a UnitedHealth subsidiary called NaviHealth. And get this, it was trained on a massive dataset of 6 million past patients. Its job, on paper, was to look at a new patient's diagnosis, their age, their level of function, and then predict exactly how long their recovery in a nursing home or a rehab facility should take. And this is where you see this huge gap between the promise and the reality. Publicly, UnitedHealth pitched NH-Predict as this helpful guide to support families. But according to internal documents and what employees have said, it was actually used as a rigid, automated gatekeeper to systematically deny care and slash costs.
Which, of course, brings us to the next really obvious question. If the tool was so flawed, a 90% error rate, why would the nation's largest insurer use it so aggressively? Well, the answer, as alleged in the lawsuit, really comes down to motive.
It seems like the strategy was basically a three-step process. First, they set these incredibly strict, non-negotiable targets. That, in turn, led to extreme pressure on employees to meet those targets, and it was all driven by a really powerful financial incentive to cut down the length of patient care, because that directly boosts profits for the insurer. And look, these weren't just friendly suggestions. According to the reports, back in 2022, case managers were told they had to keep patient stays within a 3% variance of what the AI predicted. Then, by 2023, that target got even tighter, less than 1%. And if employees couldn't hit that near-perfect number, they faced discipline or even getting fired. Suddenly, their own medical judgment was completely sidelined. So what's the real-world impact of that kind of pressure? Well, the numbers tell the story. A government report found that during this aggressive AI rollout, UnitedHealth's denial rate for post-hospital care more than doubled. It jumped from just under 11% all the way up to nearly 23%. And this timeline really shows you just how quickly everything escalated. UnitedHealth gets the AI in 2020. By 2022, these strict targets are in place. They get tightened even more in 2023, and boom, by November of that same year, a massive class action lawsuit is filed. Okay, remember that staggering 90% number? That's how often the AI was proven wrong when a patient actually managed to fight back and appeal. But that's only half the story. Because here is the other, equally crucial number. Only 0.2% of patients actually appeal their denied claims. And just think about that for a second. We are talking about elderly, sick people, often recovering from things like strokes or major surgery. The appeals process is complex, it's exhausting, and for most people in that situation, it's just impossible to navigate. So here's the really crucial point. The lawsuit alleges that the entire business model was built on this friction. The company knew that 99.8% of people wouldn't or couldn't fight back. They'd be forced to just give up or drain their life savings to pay for the care themselves, or tragically, just go without the medical help their own doctors said they desperately needed.
So how could an AI possibly get it so wrong so often? To understand that, we have to look inside the algorithm itself. It's what they call garbage in, gospel out. The technical flaws here reveal a much deeper, more systemic problem.
A huge part of the problem was just a total lack of transparency. The NH-Predict tool was a black box. Its internal logic, how it made decisions, was a trade secret. So, when a patient got denied care, their doctor had no way of knowing why. You can't challenge the AI's reasoning if you're not even allowed to see it. You just get the final answer, no.
And when you really dig into it, you find at least 4 fatal flaws. First, there's historical bias. See, the AI wasn't trained on what patients actually needed. It was trained on past insurance decisions. It was learning the company's budget, not medicine. It just automated old cost-cutting habits. Then you have automation bias. Staff were pressured to just trust the AI's output, even when it went against their own medical judgment, because their jobs were on the line. Third is representational bias. The algorithm completely ignored crucial real-world factors. It had no idea if a patient was homeless or lived alone at a fifth-floor walk-up. It was totally blind to the human context. And finally, measurement bias. The whole system measured success by how much money it saved, not by how many patients actually got better. The goal wasn't health, it was efficiency.
This quote from researcher Ziad Obermeyer just sums it up perfectly. He says, length of stay is not some biological variable. The algorithm is basically learning all the inequalities of our current system. And that's it, right? A hospital stay is often shaped by insurance rules and financial pressures. The AI just absorbed all of those existing problems and then turned them into a rigid rule for the future.
And this right here is why the UnitedHealth case isn't just an American story. It is a critical, cautionary tale. It's a global precedent for what can happen as AI gets more and more tangled up in healthcare systems everywhere.
A key failure was definitely on the regulatory side. The government rules were just too vague. They basically allowed insurers to monitor their own AI tools, which is, the classic case of the fox guarding the henhouse. Now, there's a growing argument that these powerful algorithms need to be regulated with the same seriousness as medical devices by agencies like the FDA.
And this brings up an even bigger global risk, something researchers are calling data colonialism. Just imagine exporting a flawed model like NH-Predict, one that was trained on American insurance data, to countries in Africa or Asia. It could be dangerously inaccurate because it fails to account for local genetics, diseases, and social structures. You'd basically be exporting discrimination on a global scale.
Ultimately, when you strip it all away, what this entire scandal exposes is a fundamental conflict. This isn't just a story about bad code or a glitchy algorithm. It's about what happens when the relentless profit-driven incentives of an industry are put in direct opposition to a patient's basic human right to medically necessary care.
Which leaves us with a critical question for our future. As we hand over more and more of these life-altering decisions to automated systems, we have to decide, when an AI gets it wrong, who is responsible? Where does the buck actually stop? Answering that might just be one of the most important challenges of our time.